Welcome everybody. Hello, good morning, good afternoon, wherever you happen to be today. I'm Randy Lyman. I'm the pet uncle. Today, the last Saturday in April, as it has been every year, is World Veterinary Day. If there are 4 words that every pet owner hears in their entire life, no matter what kind of animal you have as a pet, it's talk to your vet. At some point, talk to your vet, talk to your vet. Hi, Donna. Thank you for joining. Oh, your comments are coming out sideways. I hope that gets fixed. All right, you know what? Give me 1 second. I just got to turn the camera a little to try to straighten the comments out. There we go. Much better. Okay, so anyhow, I was saying today is World Veterinary Day. Every pet owner gets a, that's the words that, yes, much better. Thank you, Donna. Hi, Diana. Thanks for joining. Here's the words, talk to your vet. So for World Veterinary Day, we'll be talking here live with Dr. Aziza Glass, who is a veterinarian in Texas. And when I first saw her, however, she was a 4th-year vet school student at Cornell School of, or college, veterinary college in Ithaca, New York. She was one of many students featured on the National Geographic Wild TV show Vet School, which basically, here we have people saying, hello, Dr. Glass. Oh, and thank you for inviting followers. We'll be taking, if you have comments or questions, I will certainly write them down and pass them on as we're going through here. The show Vet School, it was really great. It really gave a great introduction and this very eye-opening look at what future veterinarians actually go through in terms of training. It's quite extensive. So we're going to be talking to Dr. Glass about that. Also about just what school was like, what the show was like, and some things just about the world of veterinary medicine and just the whole future of the profession as well. So I'm going to get started with that. Thank you for inviting followers. Thank you for all the hearts and for all the shares on Twitter and wherever you're sharing this. And so we're going to spend a little bit this morning just celebrating veterinarians and just really looking at the role that they play in our lives and in our world. So welcome, Dr. Glass.
Hello, thank you for having me.
It's my pleasure. I'm glad you could do this. Viewers out there, let me know if you can hear her okay. I think the audio should be all right, but let me know if there's any problem. I have Dr. Glass playing through a speaker here. So the first thing I want to ask you is, why did you decide to become a veterinarian to begin with?
It was I guess it was kind of not a process of elimination. It was just me exploring my options. I wanted to do something with animals, and I thought that I was going to go the PhD route, and I did all the way up until, I attempted to do that all the way up until going to vet school. I just wanted to become Dr. Glass somehow. I have both my parents have doctoral degrees, and then I have a sister that's a pediatrician and all that. So that's why my handle says Dr. Glass number 5, because in my family I'm the 5th one.
I was wondering about that. I was wondering how many Dr. Glasses there were. Okay.
Yeah. So
wow, a family of doctors. That's excellent.
So I wanted to be, I wanted to join the ranks of the doctors in the family, and around the time that I was a sophomore, I started to find more of my friends that were graduating, the upperclassmen that were graduating, talk about vet school. And it really got me thinking, and I said, well, I'll still be a doctor. I get to work with animals all the time, and I'll even know how to fix problems instead of just researching them. Mm-hmm. So I went for it, and the rest is history.
Did you have pets as a child?
No, I didn't, and that is something that I am still very disappointing about. Well, actually, I take that back. I had a turtle and some fish, and I played golf. So I took one of the turtles from the golf course that I saw crossing the fairway.
Oh, no.
So those are the pets that I ended up having when I was in high school. But other than that, no. And I always wanted to have some.
Do you have your own pets now?
Right now, no. I'm going to be, my plan is to focus on getting my feet wet and acclimated to this new career as a veterinarian first, and then add on a puppy. So
Okay.
I'm giving myself I gave myself like a one year grace period before I got one.
Okay, and you're coming up on that year pretty soon, I would think. 'Cause
Well, at least it'll be at least the January, because I took time off.
Okay.
So I didn't actually start working until December.
Oh, okay. Hi, Therese. Thank you for joining us. So how did you prepare for veterinary school? What kind of? I was reading like the list of things that you have to know: microbiology, chemistry, physics, math, all that to prepare. What was your early education?
Well, you definitely have to do the typical science classes like chemistry, physics. You have to have math. But I also was an animal science. I concentrated on animal science as an agriculture major at Prairie View A&M University. And that gave me a lot of hands-on experience with animals, especially coming from a home that I didn't have any experience with mammals.
Mm-hmm. Yes, you had reptiles and fish.
Exactly. So it allowed me to really get a good experience on and insight that this is what I wanted to do.
Mm-hmm.
And from there, I was able to intern with a couple of vets that lived in that area or worked in that area, and that's how I got my clinical experience.
Okay. We've had some other people join. Thank you all for joining, and thank you for the hearts. If you have any questions that you would like to ask Dr. Glass as we go through the show, just type them up in the comments. I'll write them down, and I'll pass those along. So I wanted to ask you about the veterinary school itself. You went to Cornell, which is one of the top veterinary schools in the country. It certainly must have been competitive to get in. And in watching vet school, we saw a lot of first-year students, and we saw a bunch of fourth-year students. I'm sorry, I'm writing down a question that just came through.
Okay.
We saw a lot of first-year and fourth-year veterinary students in the show. You were one of the fourth years. And so we got to see a lot of the field work and the clinical times. What was your 4 years of school like, and what do you do during the second and third years?
What was my 4 years like?
Yeah, I mean, how would you characterize that whole experience? I mean, was it like the hardest 4 years of your life?
Oh, absolutely. It was. I guess one of my friends mentioned this to describe his graduate school experience at MIT, and he said it's like drinking from a fire hose. And that's the type of, that's all the information that you have bombarded at you all the time. Mm-hmm. And it seems in the moment, it can be overwhelming, and you really do have to just take a deep breath and focus and just plug away and get it done. So it's not only are you drinking from a fire hose, but it's also a marathon. It is not a sprint because it's 4 years. And even the day of a big exam, we'll still have a lecture afterwards. It's not like it's the end of the day. Wow. And you just go home.
So it's not like regular college. It's you're on.
Absolutely not.
Uh-huh.
This is a whole different ballgame. It was the toughest 4 years that I have ever dedicated in my life, and it was worth it. Okay. It's what is it called with pottery? Or something where you're tried by fire and it makes you stronger and all that, or that iron. I don't know that saying, but whatever it is, that's a good saying for vet school.
Yeah, but it's grad school, so you had already done 4 years of undergrad work before going in. Yes, but it's not required. So as long as you do your prerequisites, then you can apply to vet school. So some of my classmates never actually got. Well, I think they eventually got it.
but when they applied for vet school, they did not have a bachelor's degree. They had all the, it was essentially early acceptance.
I had a comment just come in and said, it must take unimaginable stamina. You must be very proud of your success.
It is a lot of stamina. It's a lot of stamina. It's a lot of stress busters.
Yeah. Well,
but thank you very much to whoever said that.
But as I saw during the show, I mean, you learned just about every type of animal. I mean, okay, so there were small animals. I think if I recall, that was your specialty. You deal with large and farm animals. What was like the range of animals that you learned to treat at school? Were there reptiles and birds as well?
Yeah, so you had the opportunity to focus on all of those. And I knew that I wanted to do mixed animals. That's what my focus was. So I wanted to do companion animals and horses and food production animals. So the cows, the goats, the sheep, the horses, and then dogs and cats. I personally was not interested in working with small exotics or pocket pets like the gerbils and the birds and all of that. I love watching nature documentaries that National Geographic and people like that do on birds. But working with them was absolutely, like, just learning about some of the stuff with birds was just boring to me. So I didn't do that. But some of my classmates, and for instance, those on the show, like Aria, wanted to do small exotics, and that's something that she was passionate about, and I think she gets to work with small exotics in the practice where she is currently right now. So.
Right, and Elliot St. John would like the large animals and horses especially.
Oh yeah, he's a horse guy through and through, and I think he also focused on. Well, I think he focused mainly on just large animals in general, but horses, I think, is his number one.
Did you have any favorite classes or favorite teachers?
Favorite teachers, yes. Dr. Irby, who you see on the show, where she's helping us with one of the eye exams, is the episode where I accidentally squirt myself in the eye. And gave myself like my own little like Botox type of treatment. Oh no! But she's definitely a student favorite. Dr. Schwark is also one of my favorite professors there, and I think that's. Oh, and then also the Dr. Morrissey, who happens to do small exotics, and gave me a hard time that I never took that rotation.
Oh well, can't do everything. So I had a question from a viewer, which was something that I asked you yesterday, was how did you wind up on the show? How did you get selected for it and just wind up being on the show?
Well, the administration put together a team to create a short list of students that they wanted, that they feel would be good representation for the school and for the program, and also had unique perspectives on experience. I found out that I was on the short list when I received the email asking, well, first telling me about the project and asking if I was interested in interviewing through Skype with one of the producers. And I talked it over with my family, and afterwards, after getting the green light from them, I thought about it personally, and I decided to move forward with it.
Good. And you told me that you're not camera shy, that you have experience on stage and in front of a camera.
Yeah, so in Houston, I went to the High School for Performing and Visual Arts, and it was a huge, not huge as in size, but as in prominence. It's a school that is focused on the arts, and we do not only arts, but we're also very competitive academically. So within the music program, which is what I was a participant in, our program has also won multiple Grammy Awards for its arts program. And it was something that just growing up, I performed on a stage, and performing on a stage wasn't any different, at least for me, than performing on camera.
Mm-hmm.
And on the show, nothing was really staged, or maybe I would like repeat something so that they could get a better angle of it. But nothing of it was fake. So when I say performing, I don't want people to think that I was going by a script, because that's not the case. It's just that being comfortable in front of the camera to me was no different than performing a musical or something like that on stage.
Yeah, no, nothing about it seemed staged or scripted. What was it like being followed around by cameras all the time? It must have been like a 2-person crew, I'm guessing, or more than that. And were they following you all the time, or?
It was not 2 people. It was definitely a crew. And shout out to the crew, because they are great guys and gals. They make the experience enjoyable. They respected space. They did a very good job of blending, well, when they could, as much as possible, blending into the background. Sometimes it's completely unavoidable when you have like this huge boom mic right next to your face.
And you're in those small operating rooms for some of the time too. It's got to be kind of crowded in there.
Yeah, so they had to learn how to gown up and put on their surgical booties in order to get into the surgery rooms and all that. But it was interesting, and I got some remarks from some other people seeing me walk down the hall, and then you have like a camera guy like slowly walking backwards as as he's filming you. But it was an interesting experience. It wasn't uncomfortable. They made sure to not make me uncomfortable.
Good. Well, I mean, National Geographic, I mean, it's nothing if not a respectable and professional organization. So, well, good. So, I mean, so they followed you actually throughout the year, but it wasn't like dogging your every step every day.
Oh, no.
Okay.
No. Because they also had to follow the other cast members.
Right. I had a question from a viewer. Did it affect your studies at all?
No. At the time, and this is a question that I don't know how it would be for one of the first years, because they were still doing lectures. Right. But during my 4th year, I'm only doing clinical rotations. Okay. The only thing that I would say that it would affect is I became very self-conscious about not saying the wrong thing, or appearing stupid or anything like that, because I know this is going to be broadcast all over the world. And I'm representing not only the college, but also the university, which is an Ivy League, right? So there's also some pressure, and a lot of it was pressure that I put on myself. Right. Okay. And I think all of us, a part of the cast, did that to varying degrees. Yeah. Because we want to make sure that we're representing the university and the college well. Right. But I think that was the only thing. The cameras did not follow us at home. It was only at school, only at the university. It was not at all designed to focus on our personal lives. Mm-hmm.
Just to answer a quick question from a viewer. Dr. Glass went to the Cornell School of Veterinary College in Ithaca, New York. She was a 4th-year student there last year when National Geographic brought their cameras to film vet school. So, she went to Cornell, one of the an Ivy League school, one of the top schools in the country. So, was your 2nd and 3rd year, is that like mostly lectures?
Yes. It's each set of lectures and each set of courses is intense in its own way. Some people, depending on the subject matter, are going to perform better for certain courses than the other. Right. And it was each one, people said, oh, this is the toughest one. Oh, this next one is, wait until this one. And to me, it's just like all of them going to be hard. So
Right.
I might as well not even try to compare them.
Yeah.
They're all difficult in their own way.
So now that you're in a practice, you just actually out there in the world working as a vet, and today being World Veterinary Day, I'm sure you've seen. Well, the veterinary practice has been changing a lot, and some of our viewers I know that from their own experience who have worked in clinics. And the theme of this year's World Veterinary Day is a One World Health sort of theme, in that human health and animal health, those are no longer two separate things. We've seen
Right.
just huge numbers of outbreaks of things like SARS and Ebola and other things, that zoonotic diseases that get transferred from animals to humans. And the movie Contagion in 2011 was about that, the Steven Soderbergh movie. So how do you see as your role, or the role of, say, individual veterinarians in our lives, in the micro version of our lives and with our pets, but also the profession as a whole and what the profession means for the world today?
Well, I think now veterinary medicine there is a huge effort in order to increase public awareness of why veterinary medicine is so relevant. I think for a long time it was, especially at the beginning of the profession, veterinary medicine was pigeonholed as, we are only here to make sure that your cows are healthy enough for you to produce milk, and then it became, it transferred from having more of an agriculture focus to now including companion animals, because people started to have, their perception of and how they related with dogs and cats changed to the point where now they want to invest into the health of their companions.
Mm-hmm.
But it was still very much just the mom and pop vet clinics, right?
Mm-hmm.
And for a long time, that's the only thing that people think of when they think of veterinary medicine. And now, especially because of the growth of the profession, there's this realization that, yes, we have all these other facets, and we have so much, because of the type of education that we receive, we are well versed to go into any type of public health related field, but the public isn't aware of that. Mm-hmm. Because they still just see us as only giving vaccinations to dogs and cats, or any of the stuff that I mentioned before. Mm-hmm. And that's one of the things that's so good about the One Health initiative, is because it's letting people know veterinary medicine itself is still medicine. You're still practicing medicine. Mm-hmm. We are like physicians, and just like how a physician is good about doing that field does the medical research in order to figure out diseases and things like that. Veterinarians do that as well. And on top of that, we have that unique foot in both worlds. Mm-hmm. We are able to be that first line of defense when it comes to looking out for diseases, especially zoonotic diseases, because those zoonotic diseases are our patients. Mm-hmm. And it's a lot of education that we do with our clients when it comes to things that are zoonotic. For instance, the influenza, whether it's bird flu or canine flu, that's newly emerging, or leptospirosis disease, which is we're now seeing more zoonotic cases, for instance, here in Texas. So there's a lot of things that, because now we are making the effort of letting the public aware, the profession itself is starting to gain more, it's starting to appear more relevant to people who aren't animal people. Mm-hmm. And it's important for the longevity of the profession.
Yeah. All right, thank you. So I wanted to... Here, you'll forgive me for a moment. I wanted to ask you about your blog, and you'll forgive me. I wanted to just cover you up for just a second, just to show viewers your homepage, your splash page of your blog. Thank you all for joining it, for people who have showed up and for sharing as well. You have a blog now that you're in medicine. You've got your own practice. You have a blog at azizaglass.com. I just had to show everyone your splash page here. And when you go in, you get to see a bunch of photos, blog posts, other pictures, and so on. So tell me about your blogging, and what is it that you are trying to do with the blog? You seem to be encouraging others to take up veterinary medicine.
Yeah, the blog was, and I've never been a good writer, but I know because of all the different reading that I did. I was like a book nerd for a while. I was a part of the Name That Book Club in high school, and we were very competitive.
Mm-hmm.
We were top ranked. But anyway, I knew that I could write, and sometimes depending on what the subject matter was, I knew that I could write very well and have good humor about it, and just add an interesting perspective. So one of the things that got me started into doing the blog is that when I was doing the show, a lot of people were asking me questions just about vet school and grad school in general. And I decided to create a platform to make it more accessible for people to ask the questions and to submit questions. I'm sorry, that's a little doggy that doesn't want vaccination.
Oh.
But they're fine.
Okay.
But so anyway, that's how I created the hashtag Ask Aziza, and that's something that people either comment or they send me a DM, and that's how, or email through the website, and that's how they submit their questions. Actually, that is it's a nail trim.
Oh.
It just doesn't want to get this nail
trimmed. Yeah.
And now he's fine. He's wagging his tail.
Okay.
But sorry guys. But
it's all right.
So there were so that's how I got started into actually writing, and from there I wanted to expand on just my experience in general as an individual, because I personally don't want to be pigeonholed as only a veterinarian. I have other interests.
Mm-hmm.
And it goes from me doing a lot of dinner parties and creating recipes to what it was like as a vet student, and how do I think is the correct way to approach grad school,
mm-hmm.
To stuff about hair care, because I have natural hair,
mm-hmm.
and I stopped chemically straightening my hair about 8 years ago now, and just wearing my hair in its natural state with it all with all its tight coily curls has been an experience in itself. So it's a snapshot into the life of Aziza Glass, and I also like fashion too, so I get to explore and just document that. So please subscribe and visit the website and tell others about it.
I just had a question come in from a viewer. What's it like working with large animals as a woman? Isn't this a field that's been mostly dominated by men?
It is. And it has, and I think even now there are some clients that are hesitant because they don't think a woman will be able to do certain things when it comes to working with large animals. But like, for instance, with horses, you can still work with horses because they make stools. Mm-hmm. If you're too short, or when it comes to doing something like having to that relies on strength, then most of the time, just because of all of the repetition, you're going to gain the strength in your arms, mm-hmm. naturally.
Yeah.
And if it's something where you need to put just a lot of pressure on it to, like, I don't know, to figure out, well, maybe this cow is a little painful on its leg, and I'm trying to pinpoint the source of it, then you can use a tool. So it's not something that is being a woman or even being a small stature is not going to prevent you from performing veterinary medicine in any area, whether it's for wildlife or large animals.
And another viewer question, and then I want to just sort of start to wrap up, is how are animal treatments different than people treatments in terms of the kind of things that you would do or give someone? It seems to me they're kind of similar, but it would be different medicines, I would think.
Yeah, it's a lot of it is similar. There's some things that we wouldn't necessarily focus a lot on because we're mainly focusing on the health of the patient and making sure that the patient is not in pain. Whereas with humans, you still want that, but you might also have that cosmetic factor as well. And we have that luxury of not having to worry about the cosmetic side as much. For instance, when it comes to dental care, there are, if a tooth is broken or if the tooth is, I don't know, if for whatever reason, it's more likely that we can just extract the tooth and be through with it instead of having this very long drawn out process of doing what dentists would normally do, because as long as the dog is able to eat and chew its food, that's all that matters.
Right. Instead
of having to do like dentures and a fake tooth because you want the smile to be nice.
Right.
So I think that's the best example.
Okay. Well, I want
Completely different.
No, that makes sense. So I want to just give you a chance to make any last comments, and then I'll say goodbye to the viewers if there's no more questions, and then if you can just hang on for a moment after I end the broadcast so that you and I can just finish up. Anything else that you would like to our viewers to know about the veterinary profession?
I would like the viewers to know that the veterinary profession is able to contribute to our everyday lives in a lot of ways that I think is a lot of times overlooked. And I believe that that's one of the reasons why it's so important to celebrate veterinarians on things like World Veterinary Day and pay attention to the One Health initiative, because medicine is all interconnected, and the health of animals, whether you have a dog or not, whether you're a horse person or not, is going to benefit all of us. And the veterinary profession is not a profession of luxury. We do it because we really like animals, and that's what makes us smile every day. So thank you all for tuning in, and for those that watch the show, thank you for watching the show too.
And thank you, Dr. Glass. I had someone, a viewer said that you should get on Periscope and just do these live broadcasts yourself. You just sign up. It's an app. You just sign up with your Twitter account, which is Dr. at. Tell people your Twitter handle and your website again so they can follow you.
So I'm on Twitter and Instagram, and it's at Aziza Glass, so AZIZA GLASS. And I also have those direct links on my website, so check that out. I'm constantly updating the galleries and adding photo albums to also show the life of my first year as a veterinarian. Follow the blog. And I also have a page on Facebook, Dr. Aziza Glass Veterinarian. And I will think about the Periscope. I have not. People are trying to get me to join Snapchat and all this other stuff, and I just am getting comfortable with Instagram and Twitter. So I don't know if I'm going to add something else. But if Periscope fits, so far, I mean, I'll be open to it.
Okay.
I want to do it every day, right?
No. You do it whenever you want. Most people don't scope at all, but all the people watching this are watching it on Periscope or, possibly Twitter. And so I don't know. It's been a lot of fun. So, all right, at azizaglass.com or at Aziza Glass. Thank you very much, Dr. Glass. If you'll hold on for just a second, let me just say goodbye to everyone. Thank you all for watching. Thank you all for the hearts and for the shares and everything. I'm Randy Lyman, the Pet Uncle. I will be doing my regular weekly show on Monday at 8 a.m. Pacific, 10 a.m. Central on our Facebook.com/The Petscope. My show is called WAG of the Tale, and this week on Monday, I will be doing a show. I just came up with this idea at the last minute, introducing the animals of Australia. We need to see what is down there. They have some absolutely amazing creatures down there. So tune in at Facebook.com/The Petscope. There's the URL up there. WAG of the Tale, 8 a.m. Pacific on Monday, 10 a.m. Central. Thank you again, everyone, for watching, and I will see you all soon.